100. The positivity rate has improved, and that's probably the most notable improvement over the last week. It has improved now for the second week in a row, and this time it dropped from roughly 22% to 17.7%. However, our goal is to get this rate down to 5% or less. And you remember when we were at a low point back in April and May, we were down at about 3.5%. So we want to get that down to 5%. We're currently at 17.7%. Our doubling rate has increased to 18 days, which is a slight improvement from last week, but it still means that we're seeing significant community spread, and our hospital system remains under severe stress for the third week in a row. Last week, I told you about the cases of young people, and our pediatric cases, those under 18, continue to be on the rise. This week, they account for 12% of all of our cases, those cases for people under 18, which is up an additional percentage point from last week. In addition, the 20 to 29-year-old age group makes up the largest proportion of total cases. So again, that shows you just how insidious this virus is for all age groups. 1 in 5 cases are among those 20 through 29, and 5% of those who have passed away from this virus in San Antonio are under 40 years old. Young people, you are not immune from this virus, so please keep each other safe by staying home and when you can, and wearing a mask and keeping 6 feet of distance from others when you can't. Now let's go into today's numbers. Today we're reporting 355 new cases of COVID-19, which brings us to a total of 36,438 since the pandemic began in our community. Thankfully, there are no new deaths to report tonight, and that is the first time we have no new deaths to report in quite some time. Tonight, we're also reporting 1,073 people in the hospital. That's up 29 from yesterday. There are 431 in ICU, and 294 on ventilators, also increases from yesterday, which is not good. There are 45% of ventilators available in our community, as well as 11% of staffed hospital beds, and our hospital system, again, remains under severe stress. Let me turn it over to Judge Wollf.
Yeah, thanks, Mayor. And the indicators are moving in the right direction, but we still have a long way to go. We're really coming into what I would consider 2 critical months. One of them is going to be August. While there's some projections showing that our hospitalization should go down, if we don't continue to do all the safeguards that we put in place, we won't be able to achieve those goals. We know what they are. We know it's the mask. We know it's the social distance. We know it's sanitation. And we know, very, very important, staying away from large groupings. So if we're going to have a good August month, that means that school should be starting by September the 7th. So we come into another critical month, and that is how are we going to come out while we're in school. Keep in mind what the mayor just told you again. Each week we've been rising in terms of those that have been affected that are 18 years and younger, 12% now. So that means high school students are going to be vulnerable, particularly those that are, in the 17, 18, 16-year-old age group. So you have school coming, you have flu coming. And so in September, we should be getting the vaccine for flu. So we're going to have to deal with the flu, and we're going to have to deal with the COVID. So I would really encourage you in September to get your flu shot. Be ready for the flu season coming. And let me say one other thing that we really, really need to do, not only for the COVID, but also for the flu, to do all the things that we've been talking to you about as we try to fight COVID. If you look at the southern hemisphere today, where there's winter down there now, and those countries such as Argentina, Chile, and some of the others that have put in good safeguards, all the things we're talking about, they've had less flu. So if we will go into this season protecting ourselves both from the flu and from COVID and getting our flu shots, it's going to be real important if we're going to have success getting through these next 2 months.
Great. Thank you, Judge, and great advice as we enter in what is typically a period of virus transmission beyond just COVID. Tomorrow night we'll be looking at the update to our SG2 model, which shows again the projection for where this transmission and this infection will go. And what it is showing us, just as a reminder, is that we are starting to trend in the right direction, but this is going to be a slow decline. So this is an absolutely important time for us to be reminded of all the important things the public health professionals have been telling us about: social distancing, wearing of masks, personal hygiene, staying away from large crowds. So continue to do that. We now, before we go to questions with Dr. Curian and myself and the judge, I want to remind you again, you can text COSA.gov to 55000 for the latest updates. And as always, you can check covid19.sanantonio.gov. We're ready for questions.
Mayor, Dr. Curian, what are your thoughts about the story recently that came out in the Express News about contract tracing and not having enough contact investigators to deal with the pandemic early on, especially as it started to increase in June? What's being done to rectify that?
So a number of things have been put in place, and before I go into that, I just want to use this analogy that we've been saying, we've been using in the past, or we've been using recently. Is this is a 100-year pandemic, so there was no playbook, and everybody was making the best decision based on the evidence they had at that time on their available to them. So having said that, moving forward, because of this exponential increase in cases that we had seen pretty much June, by the month of June, we have made a number of changes to our practices. To begin with, we have brought in additional staffing. So at this time, we have about any given day, we have about 60 to 80 contact tracers or case investigators. We've always had a contract with IMOCA, which is our vendor for contact tracing. We have also put in place a contract with UT Health to bring in additional 200 case investigators and contact tracers to assist us should there be a surge that we have been seeing these past few months, past few weeks. In addition, we've also brought in additional city staff from various other city departments. And most importantly, to improve efficiency, we've moved into the Alamo Dome, so where all of us are co-locating. It's much easier in terms of addressing questions, facilitating training with these new case investigators. So at this time, we seem to be doing okay with the number of case investigators, and we do have the capacity to increase the numbers should there be a need.
How many contact tracers and how many case investigators do you have?
So we have 60 to 90 case investigators, and it can go up to 119. I'm talking about 60 to 90 who work full-time 7 days a week. And then we have additional capacity that comes in volunteer on ad hoc basis, if need be. And then as far as contact tracing go, we have delegated that to IMOCA, who's been doing a great job for us. And come August 3rd, we'll be also using the state to assist us with the contact tracing.
You mentioned that it looks like the numbers might start to be trending in the right direction after a long period of the virus burning pretty steadily throughout the community. Do we have, what are the indicators for when we would consider the outbreak under more control here in San Antonio?
So as far as mitigation go, one of the foremost indicator that we need to track is the positivity rate. So it's been well established that if the positivity, in order for mitigation to be successful, you have to have a positivity rate of 10% or under. And for containment of this infection, it has to be less than 3% and under. So that's foremost. And then the increase in cases as well. It has to be, in order for the virus to be contained, well contained, we have to have 1 infection per 100,000 population. We are nowhere close to that. Yes, the indicators are trending in the right direction, like the mayor said, but keep in mind, we still have very high positivity rate, and we are still averaging about 300 to 400, sometimes even 700 cases a day.
In terms of the positivity rate, Mary, you mentioned, or is the last time we were at 5% or below, was in May?
I believe it was. It was some time ago. It was certainly before the spike started happening in June.
Our lowest positivity rate was 3.6%.
When that was?
It was sometime around May. Yeah, just before.
Yeah, I think it was late May is when we recorded that.
Going back to the contact tracing, I know that the process now is within 14 days, Metro Health, or rather investigating. Metro Health contacts these people 3 times, and if they're not communicated with, they're eventually marked as recovered. I don't know how that's changed since the beginning, or if it has, because I know you're following CDC recommendations in how often you contact somebody. Has that reduced in any way? Are you contacting them less than you were before, or is it the same? You communicate 3 times and document it.
The standard is still the same. We make an attempt to contact the patient 3 times, or the positive cases 3 times, and if we don't meet with success, then that case is considered administratively closed, and then we do an estimated recovery if it's past 14 days from the date of testing or date of onset of illness.
Dr. Karian, DSHS is now saying that death certificates, they're going to be using that instead of local reports to count COVID-19 fatalities. Can you explain what that means?
So that's not a new practice. We have always tried to do a vital death certificate review to capture additional deaths that might have been missed. So this is not a new practice, and we've been doing that at Metro Health since the beginning of this pandemic.
Dr. Kieran, if we could talk about the outbreak at the children's shelter, do you have any updated numbers on that? And also tell us the type of assistance Metro Health is providing to that facility.
So this is a children's shelter at Woodlawn location where they had 12 children positive and 5 staff positive. And they were tested on the 17th. It was reported, the test results became available on the 24th, and we became involved on the 24th itself. So majority of these kids have been asymptomatic. So at this time, they're on their 10th day from the date of test. Yes, almost a 10th day. So it's pretty much towards the tail end. So our congregate setting team is working closely with this Woodlawn location, with this children's shelter, and they are offering testing for all those folks who tested negative initially. So a second round of testing will be done for folks who tested negative during the first round.
Is it the same concern when you say congregate setting, the same as we've seen within nursing facilities, although this time it's children?
It's children, and they are placed in close quarters, in close confined spaces, yes.
With that, is there any way that since school obviously is kind of a discussion, this type of setting, could that even be correlated to a school type of setting when we talk about it spreading among children?
It could be, but we have, with schools and even with the shelter, they are practicing and putting in place the measures that we've been talking about, such as physical distancing, use of face coverings. And there is always a risk of that, of a staffer, especially when you have this widespread community transmission happening. There is always a risk of a staffer bringing it in or a visitor bringing it into the facility.
This is the first day we've seen an increase in hospitalizations, probably in about a week or so, and I realize it might be too early to make a hypothesis as to what might be driving that. Any initial thoughts as to why we're seeing an increase in hospitalizations now?
I mean, I would just be cautious. One day does not a trend make. We've seen increases like that periodically, a little bump here, and then as long as we're trending in the right direction over a period of days. I will say also we've seen a pretty volatile day-by-day number in ICUs and ventilators as well. So, the truth of where we're going it will really only be known over time, and so let's look at how it's continuing to trend by the end of the week.
Are any numbers available on the number of COVID patients in long-term acute care facilities? Because we know that some people are actually discharged from ICUs, still very sick, sometimes still on a ventilator with a trace. Do we kind of know what the proportion of that is? Because that could also be lowering the hospitalizations.
Yeah, go ahead, Donna.
I was just going to say we don't have that number. I don't have that number with me, but I can certainly get that for you. You're looking at number of folks who've been discharged from the hospital into the long-term care facilities, correct? I don't have that number just with me.
Yeah, and that would be a question for Eric over at STRAC, that he would be able to answer that. But it's been a consistent couple dozen every day, I think, that are relieved from the hospital into other facilities. But generally speaking, when they're discharged from the hospital, they're doing better than when they got there.
Judge, can you give us an update on the latest on the overcrowding at the jail? And can you explain what is causing this again?
Well, it's not getting any better. In fact, it's getting worse. We're over 3,600 as the last report I've got, up from a low of 29. And, you know, there's two issues. One is the paper-ready people that should be going to the state prison system, 390 or so. The other relates to the governor's order that he put in, taking away discretion from a judge. If there's any sort of a violence in the past, whether it's just pushed somebody or touched somebody, a lot of the magistrate judges are not allowing us to give personal recognizance bond. The personal recognizance bond have gone down to 1/3 of what we were issuing before. I spoke to Judge Ron Hale, who's the administrator for the criminal courts. He's talking to some of the magistrates, but it's a continuing, growing problem for us that states put us in bind on both of those things, and we're now running out of room to really separate jailmates like we should be able to do.
Are there any steps that you can take?
We're
Moving forward, like anything that you can ask the state right now?
Well, we ask them for things all the time, but they're, you know, it's like saying a prayer and you don't get an answer. It means God said no. It's kind of the way they're operating. We can't get them to do anything.
We have a text question from Nancy Tannehill of Telemundo. She'd like to get the mayor and the judge's reaction to Governor Abbott's announcement today waiving STAR testing as a promotion requirement for students in the 5th and 8th grades.
Well, I got my opinions.
Well, I do
Go
too.
ahead.
I think it's a good move. I wish they could do that more often, use the test as a diagnostic tool rather than forcing every teacher in the state to teach to a test in order to secure funding that they need to run their classrooms.
I agree 100% with that. You know, that's been one of the major shortcomings of the schools is that they try to teach toward a test. You know, doing these statewide tests, if I was up to me, I'd throw every one of them out. We should leave it to the schools to do the grading system. I think that's a good indication in showing how a student's going. But as far as these tests that they've all set up, it's a waste of time, waste of money, and doesn't really get the student ready to enter real life.
Did we take any evacuees from Hannah at all over the weekend?
My understanding is that we had one person who came to the reception area that was set up for the hurricane at Freeman, and they were given shelter through Red Cross.
Yeah, we're lucky that we didn't have a big influx, and
There was no evacuation
Yeah.
order issued on the
Yeah.
coast, so that didn't really affect us. But it was a good opportunity for us to stress test all the systems with COVID in place.
Judge, how many inmates tested positive and how many staff tested positive?
I think right now, on our latest figures, we have 65 that are positive. Remember, at one time when we were getting cooperation with everybody, we only had 20, and it stayed that way for a long, long time. And then we do have a number of them in the area where we treat patients that do get a little bit sicker. And then with respect to the people that are working, we still have 24 law enforcement and 47 detention officers that are out, and then including another 22 civilians that are out. So it's a combination of both things that are helping us. Stuffing jails full again, which is absolutely madness. And then we're also having trouble with our own COVID cases with respect to detention officers and civilians.
In the race of a vaccine, I was reading about one of the world's largest underway today, and some of the clinical sites in South Texas, San Antonio being on the list. We're seeking like 30,000 participants. What does that mean for San Antonio to be a part of something like this?
It's always good to be part of a big clinical trial, right? So this is phase 3 of the vaccine trials, and the more people participate in this phase 3, the better we have a better idea we have on the vaccine efficacy and the short and the long-term side effects of this vaccine, if there are any. And so we strongly encourage folks to, there is a lot of apprehension about this vaccine because it's a new vaccine, but our recommendation is we strongly recommend that, folks, especially those high-risk folks, seek out participation in this trial.
Dr. Carrion, just a reminder to people who are experiencing very severe symptoms, COVID-19 symptoms, what do they do if they're feeling extremely sick because the hospitals are stretched thin right now?
If you're experiencing any of those warning symptoms like persistent pain in your chest, difficulty breathing, confusion, dizziness, bluish lips, then our recommendation is to go ahead and call 911, seek medical attention promptly, or if you're planning to go to your local ERs, call them ahead of time. Seek medical attention promptly.
Yeah, and that also reminds me something I didn't state during the earlier part of the briefing. I was told that over the weekend, over the last few days, there has been an increase in donations of plasma with COVID antibodies, so let's keep that up because we need it. And so if you are interested, if you have suffered from COVID and now have recovered, please contact southtexasblood.org and get tested. You may be able to save many lives just through donation of plasma.
Circling back to the way that the state is going to start counting coronavirus deaths, the state dashboard shows that Bexar County should have like 480, and that's obviously significantly higher than what we currently have. Can you guys comment on that discrepancy?
I haven't looked into the dashboard just yet, but all I can say is that we are counting every death that's reported to us as COVID-related or COVID-contributed, either from the hospitals, vital records, or from the medical examiner's office.
If I can go back, and you mentioned that Hannah was a bit of a stress test. Like, we're still kind of in the early to mid part of hurricane season. What are some of the things that San Antonio has learned in helping other cities respond to this in the age of COVID?
Well, I mean, I think you have to rewrite the playbook with regard to how you conduct an evacuation. Obviously, evacuations are the antithesis of physical distancing, so we are set up with different types of family units we might see arrive to San Antonio, different shelter scenarios for them. In many cases, hotel rooms. There's also congregate shelter that would be available for some folks. But, I think that every aspect of the emergency response is going to be a little bit different given the fact that we're trying to suppress an infectious disease.
Exactly right. That's why they moved toward motel rooms, so you're not putting everybody in one place. I know at one time we had 500 first responders out at the Coliseum. On another one, you just can't do that anymore, or you shouldn't do that anymore, because it's dangerous. And they also staged, I think, about 500 buses out there. And I'm thinking, what are you going to do, stuff it full of people and let people get COVID on the ride back? So it's going to have to be handled different.
Thank you.